I am Rossella Nappi, Professor of Obstetrics and Gynecology at the University of Pavia, Italy, and I have a long-lasting interest in menopause and sexual medicine. Let's understand together why the diagnosis of vulvovaginal atrophy is so important in clinical practice and which parameter we should consider. Atrophy is an aging process that can involve the whole body of women. At vulvovaginal level, cell death reduces the thickness of the mucosa and causes the loss of the characteristic folds. The vascular system is also involved as it is no longer able to lubricate the vagina. In addition, the absence of lubrication increases the friction within the vagina, thus favoring, along with loss of elasticity, the occurrence of micro-injuries. Altogether, this event causes an increase in the pH, leading to vaginal dysbiosis and greater susceptibility to infection. The primary cause of vulvovaginal atrophy is the estrogen deprivation. Indeed, estrogen are the hormones responsible for thickening the mucosa and promoting the ability to lubricate. In menopausal women, aging is strictly linked to estrogen deprivation, and this is the reason why vulvovaginal atrophy may be considered a real chronic condition. The main symptom of vulvovaginal atrophy is vaginal dryness, along with other inflammatory processes such as burning and itching, and they all together make for women difficult to be seated for a longer period of time. These symptoms have a strong impact on women's quality of life, affecting both social relationship and working abilities. Sexual activity is also compromised. Vulvovaginal lesions and reduced lubrication lead to dyspareunia that reduces the ability to achieve orgasm and is the starting point for sexual dysfunction. This is an automatic reaction that, by contracting also the pelvic floor, reduces the ability of women to respond to sexual stimuli. This induces sexual pain and low sexual desire. 55% of these women reduce sexual activity because of the pain, whereas 46% experience a loss of sexual desire. Variations in sexual activity impacts on self-esteem and relational stability. Vulvovaginal atrophy is a physiological condition for more than 1 billion of menopausal women. There is also a significant number of postpartum lactating women. They suffer from vulvovaginal atrophy, and this is related to the fact that prolactin prolongs the hypoestrogenism. Among pharmacological causes, we find chemotherapy and radiotherapy for the treatment of female tumor, which determine the loss of ovarian function with a rapid and premature onset of the menopause. Up to 64% of these patients experience a loss of sexual desire. The impact of cardiovascular diseases affects 40% of postmenopausal women, and this is a very important topic because it was the topic of the World Menopause Day in 2023. And we should know that antihypertensive drugs cause atrophy. Finally, around 20% of women during their fertile age use oral contraceptives, and in 30% of them, vaginal dryness may be present. And in 50% of these patients, this may affect significantly sexual function and behavior. This tells us how important it is to create an empathetic bond with our patient, We should be proactive in opening dialogue to make an appropriate diagnosis and to treat vulvovaginal atrophy effectively. It's really time to avoid the silent suffering.